Good evening, everybody. We have some turnout. I am humbled to be in front of you, and I want to start by saying that I feel like I'm with Mishpacha, because truly the Chabad community has had an intense, what I believe is no coincidence, effect on my life, starting in 1966. When I was in a Hebrew school in Queens, and I went to public school, and for 3 days after public school, Monday, Wednesday, and Thursday, 4 women from this community, probably in their early 20s, drove from here to Little Neck, New York, Little Neck, Queens, and sat with me and my peers and taught me how to daven and taught me how to observe Chagim. And when I say Shema, and I say Shemona Esrei, and I now have kids that live in Israel, and I have kids that are in New York, they're products of this community. That's how I feel about this community. I asked my wife, can I mention the woman, the main woman who had this impact, who my sister went to spend Shabbosim with in the late 60s? My sister is a psychiatrist. She's 4 years younger than me. She came to this community to learn how to be a Yid. And so my family, my grandchildren are indebted to this community. And to be here is just it's an honor, and it's what I'm supposed to be doing tonight, without a doubt. I want to start off by saying that we are all geniuses after the fact, particularly therapists, of which I'm one. We all know what's right after things happen. And so we need to be humble when we look at this phenomenon, this drug addiction, this alcoholism, this comorbidity. And we need to not blame. We need to not pick out scapegoats and blame people and groups, because it's unhelpful. And it's divisive, and it pushes people away. We need to learn. We need to come together like this, and if I'm saying things that you've been doing already as parents, and my suspicion is there are a whole bunch of parents in this community tonight, if you're doing the kinds of directives that I'm going to suggest and encourage, please keep doing them. If you're talking to your teenagers, if you're talking to your younger children, which you can do, you can learn in an age-appropriate way how to talk about refusal skills. You can learn how to talk about substances as the kids get a little bit older. Then keep doing it. And if you're not doing it, then we need to work on how to desensitize yourself so this can become an age-appropriate discussion that's initiated by parents, by Rebbeim, in the chinuch system, in shuls, and that this night is not an end-all night. It's a continuation for some people, and it's a beginning for other people, and that's what it needs to be. But if folks are under the impression that we'll walk away and this thing will be fixed after tonight, we all know that can't be. This is a process that needs to continue, and it needs to start if it hasn't started yet. I just want to talk about the fact that kids, teenagers that develop addiction often, if not more than often, come from good families. Be aware of that. They come from good families. I'm going to speak a little bit now about what some of the higher risk categories are that I have come to learn over the years. In the decades I've been treating addiction in families, in individuals, in teenagers and adults. And I will say that there are different stages of addiction, of alcoholism and substance abuse, and I'm including alcohol because alcohol is a legal drug and it's a drug, and people need to be clear about that. And I'm also going to say that most people that drink don't have problems. Sometimes when I'm invited to speak with groups, there's a kind of stereotype that this guy, all he does all day long is deal with alcoholics and addicts of all ages and shapes and sizes. He must just think that anybody that touches alcohol has a problem. There could be nothing further from the pure proof. Most people that drink alcohol do not have problems. I don't know that I would say that about people that use cocaine and people that use heroin. Obviously, I'm being facetious. I would not say that. But with alcohol, most people that drink don't have problems. But there are a percentage of people that drink. And one of the cornerstones of what we've learned over the last 10 years, 15 years, is that if we can hold off a teenager from experimenting and certainly from crossing over a line of any kind of consistent use of whatever the substance is, they have a much better chance. If they could make it into their 20s without using or using minimally and stopping, and then later on make decisions about their use, they have a much, much better chance of not crossing over a line. I will share with you, in most of my experience, until 15 years ago, my experience in this field came from the secular community. I was not in the Jewish community. I was hired to run the Yatskin Center and moved back from Scranton, Pennsylvania to New York City, to the metropolitan area in 2001. And so it's only since 2001 that I've been dealing with Yidden, with Frum Jews, because the Yatskin Center was a place that was for teenagers from 13 to 19 years old, and it existed for about 8, 9 years. And it's unfortunate that it's not around today. It served a viable purpose. I don't want to go into why it doesn't exist any longer, but there are some other programs that have taken its place. But I interviewed hundreds of kids in the 7 years, 8 years that I was there, and I will tell you that not one of them said, when they came in and we did this evaluation to see if they really were appropriate, not one of them said, I just woke up one morning and decided I'm an alcoholic or I'm an addict, and that I'm going to come into treatment. It was a process. And in the early stages of this illness, whether you're 13, 15, 25, or in your 50s and 60s and 70s, in the early stages, and there are stages, in the early stages, it's very difficult to tell who has the problem and who doesn't. I'll tell you another interesting thing about alcoholism in teens, and there were questions asked, and we can talk more about this in the question-answer part of the program. How can you tell? What are the signs and symptoms of addiction in teenagers? And one of the first ones that I would mention is attitudinal changes. Well, that's a sign of teenagers. That's not solely a sign of addiction. That's a sign of the developmental stage of being a teenager. And attitudinal changes and a tumult, a confused, a trying to find an identity. And so this is an age group that is susceptible to curiosity, that is susceptible to looking at adults. And one of the points I would make is that we need to be very clear that teenagers are watching us, are watching adults like hawks. They are extremely plugged in, not to what we say as much as what we do. What we do is the telltale sign of this. And so this phrase role model, which in some respects is overused, I don't think can be used enough tonight in terms of when you, as a parent of your kids, as a parent of the peers of your children in the community, just know that adolescents are very plugged into what you're doing. And I don't think there's any stronger population in detecting contradictions and hypocrisy than adolescents. Adolescents have an antenna that is so clear and so precise and so efficient in uncovering when somebody is saying something and doing something else, particularly when the behavior is not congruent with what's being said. B is intensely aware of that phenomenon because it exists. Higher risk teenagers are teenagers that have various comorbid diagnoses. Teenagers that are suffering from anxiety, for example, have a higher propensity for being introduced to and certainly experimenting and sometimes at least crossing over lines with substances. A teenager that has social anxiety, for example, and that's just one example, and feels uncomfortable around other kids and around adults and just uncomfortable, anxious. Whether it's because of trauma, whether it's because of OCD issues, whether it's because of a generalized anxiety, whether it's phobic, whatever the specific type of anxiety is, that teenager has a higher risk of developing some kind of problem. Kids with learning disabilities as well. One of the categories of teenagers that we saw repeatedly at the Atkin Center were teenagers who could not make it in the yeshiva system, whatever borough or city. We had kids from Europe, we had kids from Israel, we had kids from all over the United States. There was a very, very common variable, and that was that these teenagers, for a myriad of reasons, were not able to make it in the quote-unquote conventional yeshiva system. They were kids who were encouraged to fit in, to learn a little bit differently, a little bit better, and for a lot of reasons. And some of them were just learning disabilities. Some of them were attention deficit and focus problems. Some of them were emotional behavioral problems like depression and anxiety. But for all these different reasons and more, they did not fit in. And I don't know that it was anybody's fault necessarily, but there were not alternatives, except that what happened, like magnets, is that they met other kids that did not fit in. And that became the beginning for most of the kids in that category, which is a pretty significant category. That became the beginning of bonding and of experimentation. There are three types of teenagers that I've met in my work. There is the teenager that just says no, who has not done any experimenting for also a whole bunch of reasons. Not one specific reason, but often because there is healthy fear. I don't want to get involved. Sometimes these are teenagers that have some kind of problem in their family, and they've seen adults in their families that have suffered from alcoholism or drug addiction or psychiatric issues, and they have the wherewithal, and some of them have been told, and if you have any kind of addiction in your family, parents, grandparents, aunts, uncles, cousins, extended family, it behooves you at the right time, in the right way, to share this with your children at the right time. They need to know this, just like they need to know if there's diabetes in your family or if there's high cholesterol in your family. They need to know. This is very important information for them. This gives them something that who knows when, maybe not immediately, but that someday, hopefully sooner than later, they can connect dots with the help of some other people often, and they can make some decisions that are healthy decisions. High-risk category are those kids that are being bullied, for sure. Those kids that have sexual confusion of their identity. They're not sure what their preference is sexually. That happens often prepubescent and then in puberty and in beginning adolescent and well into adolescence, that kids, there's a certain percentage of our population that is confused. And if we don't talk with them about this, if we don't encourage them and invite them to share what this is like, they go underground. And often there is tremendous shame with bullying. There is shame with not doing well in school. There is shame in not being successful and watching other kids. Now, in the beginning of this disease, this illness, there are plenty of teenagers that look very good. You can't tell. They are excelling in studies. They are steiging with Gemara. They are learning in a very, very high-level pace. And they're model citizens at home as well. And they're model citizens in their peer groups. And slowly but surely, a certain percentage of these kids, and it's somewhat counterintuitive, they are starting to develop relationships with getting high. There are some kids that are genetically predispositioned. We talked about families. We talked about biochemistry. There are some kids that are predisposed to enjoy altering their consciousness. You might see this with real young kids. And sometimes it gets outgrown, and they'll spin around until they get dizzy and fall down. And when you take them to an amusement park, they can't wait to get off the roller coaster and get to the back of the line to go on again. There are other kids, and adults for that matter, that wouldn't go near a roller coaster. It makes them sick. They don't like the feeling of being out of control. This carries over to the practice of experimenting. So that second category of kids that I've met, the first category are the kids that just say no. The second category are kids that are beginning to experiment. They are checking out what it feels like. They have watched other people, often adults, older siblings, people in their community, and almost as a rite of passage, they are checking out what it feels like to drink to excess or to experiment with drug marijuana, which is one of the most misunderstood drugs of any drug you're going to hear about tonight, marijuana, which is so harmlessly seeming to a majority of people. Thank God he's only smoking up. First of all, I don't know any kids who went from nothing to opiates. There was a segue into opiate use and addiction. In our community, in our culture, the vast majority of experimentation, first time, second time, beginning experimentation, happens in Jewish functions. It happens at Chasanas. It happens at Shalom Zachars. It happens at Farbrengens. It happens on Shabbos. That's where, in my experience, across the board, Frum kids have been introduced. So we have to be careful about that. In terms of parents, and maybe we'll get to talk about this some more as the evening goes on. In terms of parents, my cursory message is, number one, to learn as much as you can, to become as much of an expert as you can possibly come in this topic that we're talking about. When you engage kids in discussions and you don't know what you're talking about, you lose credibility. Talk to other parents. There needs to be communication from parent to parent. When you say no to your kid, which is something that you need to do, at least on occasion, and your kid says you are the toughest parent. Anybody in this room ever been called the toughest parent in the community? You're unreasonable. You know, what are you doing? Chill out. Lighten up. When you call other parents about forbidding your kid to go to an event, or many examples, and you find out they're forbidding also, you learn you're not the toughest parent. To develop dialogue, and we can do that formally as well, but certainly informally. The most important thing is to talk, is to be able to introduce topics. When my kids were adolescents, and they had the luxury, and I say that tongue-in-cheek, they had the luxury of having a father who ran a drug and alcohol rehab. It's not a great thing for an adolescent, particularly when there's any kind of interest in experimenting, that your father is the head of a drug and alcohol program. But when I got them in a car and we went for a ride, they were captive audiences. We had to talk. For me, it was a great ambiance, a great medium to talk. You need to get comfortable talking about this. When you make decisions, for example, about, and some families do this, some families, when the kids get to be teenagers, the alcohol goes away. It gets locked up, it doesn't get bought, it gets removed from the house. They drink grape juice for Kiddush. In other families, that doesn't happen, and the kids are taught to see responsible consumption, holy consumption, on Shabbos, for example, of alcohol, of Kiddush. I can make arguments for either one of those directions. But those two directions, which seem very opposed to each other, are meaningless if you're not talking about what you're doing with them. And you're not inviting them to talk about how it feels. It doesn't work if you don't talk. In terms of the Rebbeim and the leaders of the community, the leaders of schools, the leaders of parent groups, it really makes sense to have education about this, because what I'm throwing out there is learning the signs and symptoms, learning how to intervene, learning how to engage, learning how to teach refusal skills. That's not a one-night quick speech kind of process. That takes a little bit of time. It doesn't have to take years and years at all. It needs to become part of the culture of a community. But it involves people having access and being encouraged to participate, to come and to do what the people in this room are doing. Because for every person that's sitting in this room, think about how many people need to be here that couldn't come because it was too risky to be here and listen to this and sit. This is not easy stuff. This is not fun stuff. What you must do if you're going to do this in a increasingly and in a growing kind of effective way is to look at yourselves. We need to look at ourselves. We need to really do an inventory in terms of how comfortable we are with this whole thing, and then translate that into starting slowly but surely to become desensitized. With professionals, it is important, if you're worried about any situation with a kid related to substances, you need to proactively go and get information and sit with a specialist and ask. It's worth it. Often, parents and adults need to do the work first. They need to set the tone. And if a kid says, I'm not going for an evaluation, you need to go anyway. You need to go yourself if they absolutely refuse to go. You need to work on this and learn about it and take charge and not be in an only solely reactive position. That's what prevention is about. I think I'm out of time. Maybe we'll be able to talk a little bit more later. Thanks.